Hi, this is an overview on how to use Health Indicators Warehouse. This resource, as its name suggests, is a warehouse of indicators and other data sources from various associations, committees, and foundations. You can find this resource at www.healthindicators.gov. There are 3 ways to find indicators on the HIW site. The first way, we're going to use the search box here in the top right hand corner, and we will start keying in our topic. I'm going to use the word immunization, and as you can see, as you start typing, it will try to pull from their list of keywords, so I will click on immunization. It found 41 indicators that contained the word immunization. On this list, you can see they're in alphabetical order by indicator title. Underneath that is the data source where that indicator comes from. To the right is the geographic level. So some indicators have information on the national, state, county, or hospital referral region level. As an example, the hospital referral region in Nebraska, we have the Omaha and the Lincoln hospital referral regions. And then the next column is the most recent information that's available for that particular indicator. When you use the search box, you want to be careful about spelling and terminology. I can use the word vaccination, and it's also in the keyword list, and I will click on vaccination. You would think vaccination and immunization are pretty close, but we find 35 indicators that contain vaccination, where there were 41 indicators for immunization. So we can click on one of these. So the antibiotic selection for community acquired pneumonia patients. So it's comparing pneumonia patients with the appropriate initial antibiotic selection. You've got the overview, which gives you the numerator and the denominator of this data, and the methodologies, how they came up with these numbers and some of the references. There's also related keywords. So immunization and vaccination are both in here. If you are having trouble finding things, you may want to look at the related keywords list to see if there's a word that you could be using that might be better suited. We'll click on the table to find out the information that we're looking for. This is at a national level. If we click on this drop-down box, you can see that the state information is also available. We'll go down to Nebraska. And the county information is also available. A list of counties in alphabetical order, plus way at the bottom is the 2 hospital referral regions. So if we click on Omaha, we will find specifically in the Omaha hospital region what percentage of pneumonia patients had appropriate initial antibiotic selection. Another way to use to search for the indicators, if we'll click on Home, Health Indicators by Topic. So you can look for chronic diseases and conditions. If we click on that, we'll get into this indicator filter list. In the chronic disease and conditions, you can see their list of conditions. We're going to click on heart disease and stroke, and we need to click on this little plus sign. We will go from 207 indicators down to 43 indicators, and there's one more level. We can click on heart disease, and we'll get down one more level, which will get us down to, hopefully, 17 indicators that have all 3 of these filters. These filters will remain in place until you remove them, so sometimes if you are not finding enough information, you may need to back off on some of these and go to a broader list. So in this list of 17 indicators, a lot of them are at the hospital referral region level. We can look at Medicare beneficiaries that have heart failure. And again, you can see some of that information. We're going to look at the map. The map will let us compare from one state to the other how we're doing in this area. And here it comes. So you can see the number of Medicare patients that have heart failure, and by these different colors you can see how we're doing in comparison to other states. Going back to the home screen, if you click on resources, you can see where some of these resources come from, where some of the initiatives, some of the data sources. There's also a glossary if you need some information on what a particular word or phrase means. There's some helpful resources such as a user's guide that you can download as well. If you need more information about this resource or others, you can contact the reference desk at the Health Sciences Library at 402-280-5138.